Greetings all, my name is Jacob. I'm a physical therapist, currently practicing just outside of Dallas, Texas. I currently work in pediatric sports. Kind of a little bit of background of where I'm coming from on this talk. As a young clinician, I was really interested in the idea of getting a better measure of objective strength, but I was having a tough time convincing my bosses and clinic managers to buy one for me. When I started looking around, the price points I thought were just flat out ridiculous. Um, so we set out on a journey to try to make something that's a little bit more affordable and versatile for the everyday clinician, somebody that doesn't have an unlimited budget. So that's how we ended up with Peak Force. But this video is not about Peak Force, it's not about our stuff. Really, you can use this with any dynamometer. We think that dynamometry has the power to improve clinical outcomes and clinical practice, and that's what we're passionate about. So today we're going to talk about why strength is important, some of the finer points on how to test for strength, and how not to test for strength. So, is strength important? Why is it important? Do we need to measure it? Well, we're going to start with probably the most common example, and that's in the case of an ACL injury. We know that deficits persist long after an injury. We know that strength has been shown to be important for outcomes. If you get their strength back, it leads to a higher return to sport likelihood, reduces their re-injury risk, and I think most importantly, reduces their long-term risk of osteoarthritis. We also know that strength changes early. So this is a study looking at individuals that were injured but have not yet had surgery. So think of them as being in their prehab phase. You can see they've got almost a 25% strength loss on their affected quadriceps for their injured knee already, even before surgery happens. So that strength happens early, and if you're not measuring it, you're not going to know. Systematic review kind of shows that uninjured limbs and healthy limbs are pretty similar across a wide population, but we still see pretty sizable strength deficits in the injured limb. And that's something that we see over and over and over in the rehab. Getting that strength all the way back, and especially in an ACL population, is really, really tough. Do these individuals pass their return to sport tests? Well, honestly, really, no, they don't. 2017 Tool article showed that only about 14% of the participants passed all of their return to sport tests. This is strength and hop tests. You can see the box over on the left side here. The blue bars show percent of individuals that met the standard for passing the test, and the orange bars show the individuals that did not meet that. So you can see a lot higher blue bars over on the right. Those are going to be functional tests like hop tests. And then over on the left, the true objective strength tests, a lot higher orange bars than blue bars. So how do these individuals return to sport? Well, the column over here on the left in table 3, you can see these are the characteristics of the people that return to sport. You can see across the board, they just have better measures. But we highlight these strength measures. You can see the column on the right, the individuals that did not return to sport. Well, especially their quadricep strength was still nearly 30% different than their unaffected limb. What about re-injury risk? This is a super widely cited study. This is the one that we all kind of use for our 9-month return to play recommendations. And they found that for every 1% that you increase your limb symmetry for your quadricep, it reduces the re-injury risk by 3%. So even if you're within that 90% threshold that we all think is pretty good, getting that even a little bit higher helps to reduce that re-injury risk. So we think strength is hugely important in this population. And for me, I work in pediatric sports. I'm working with kids all the time, sometimes as young as 8 or 10 years old that have torn their ACL. Certainly we want to get them back on the playground. We want to get them back on the field. We want to get them back to their sport. Usually they're telling me that's their goal when they walk in. But I'm thinking about how are they going to be doing 15, 20, 25, 30 years down the line? Are they going to be, we know that they're already at risk of developing osteoarthritis early on. Our goal is to try to mitigate that risk as much as we can. And we know that, again, for every 1% we improve the limb symmetry index, there's a 4% lower odd of developing clinical osteoarthritis. So this is a big, big one that I'm really focused on. If we can improve their strength and reduce their risk of OA, we're going to for sure want to do that. So not only in a knee or an osteoarthritis example, but lots of studies that show injury risk based on strength asymmetry in other joints as well. So you can see shoulders, hips, ankles, the list goes on and on and on. So we think testing strength is important. If it's important, how do we do it? Well, we do have a few options generally. 1 rep max and the derivatives of 1 rep max are pretty commonly used in a weight room. So think about your traditional bench press, your back squat, your deadlift, even things like power cleans or overhead lifts, Olympic lifts, snatches, things like that. 1RM certainly gives you a value. Just about all the time, your 1RM is going to be some sort of a compound movement. I very rarely see people testing isolated muscle tests. I don't see a lot of knee extension 1RM maxes. I don't see a lot of bicep curl 1RMs. But they are pretty standard in a strength and conditioning setting. Again, it is a good, valid measure of how much force someone can develop. So we do think that it's a good strength test. Some of the cons are that technique can be a limitation sometimes. So if you have an individual that's not familiar with the weight room, like I said, I practice in pediatric sports, and I have people all the time that maybe they've never back squatted before. Well, for me to say, let's just load up a barbell and put it on your back as high as we can to see how strong you are, that may not be the best idea. We may need to take some time to develop some technique, make sure they're safe. And it can be potentially time consuming. If you have somebody that doesn't have any idea what their 1 rep max is, it might take a little while to work your way up to that. So certainly 1 rep max, a valid, a tried and true tested measure of strength, but not necessarily for an isolated muscle group. And there are some drawbacks to that. So I don't know about you guys, but I remember as a PT student, probably 10 years ago now, being taught manual muscle tests and kind of looking around the room with a puzzled look on my face, like, well, how do I compare my 4 out of 5 strength to that person over there, to this other person over here? It didn't make sense to me just intuitively. How are we objectively delineating these tests? We could do our very best to try to define what these means, but I think at the heart of the matter, just on a face validity perspective, we all kind of understand that these are not as objective as we would like. And we do have a couple of studies to kind of back that up. So this is a little bit of an older study that looked at elderly stroke patients. And so what they did is they asked clinicians to measure their strength in 2 ways. They looked at manual muscle tests, and then they looked at handheld dynamometry, and then they compared the two. And what they found was that individuals needed to have over a 30% difference in order for a majority of clinicians to be able to tell a difference with their manual muscle tests. So they're just looking for symmetry side to side, and they noted that you needed a really, really big difference to be able to tell with a manual muscle test. Another study had a similar design. They're looking at the upper extremity this time, and they noted that you need upwards of a 40% difference as measured by dynamometer to determine if they are symmetrical via manual muscle test. So not to say that they're totally useless. We use them all the time in the clinic. I use manual muscle tests with patients almost every day, but we like to consider them as more of a screen than a true test. I think of it as more of like a pseudo-objective measure, and individuals need to have a really, really big difference in their strength in order for you to tell a difference. Well, what are people using to determine whether or not people are going back to sport? So a couple of surveys that we'll highlight here. This first one is in the PRISM Society, so that's Pediatric Research in Sports Medicine. So these are physicians, athletic trainers, PTs, researchers that work with youth athletes, and they asked, well, what are you using to measure strength? And most of them said MMTs. Almost exact same study design, a little bit different set of respondents, same results. The majority are just using manual muscle tests to determine return to sport decisions. Well, we think that's a bad idea, and let me tell you why. So what we did here is we ran our own little experiment. So my volunteer set up on a Biodex machine in the position that I would test a knee extension manual muscle test. So me as a clinician pushing down, I wanted to know how hard can I push? Because if somebody can exceed that, well, then I need to know what that limit is. And so basically what I found is that I can push down at 105 foot-pounds. So if I have an individual in front of me and I put them in this position and I push down on them, I know I can push down 105. So if I can't break them, then I know that they're at least pushing 105. Well, if they're 5 out of 5 on both sides, does that necessarily tell me that it's symmetrical? Well, there are a couple of different options here. It could mean that their left leg and their right leg are both exactly 105. It could be. It could be some number way higher than that. It could be they're both 200, 250, 300. Or it could be that their left is 105 and their right's 200. I can't really tell. My test isn't maxed out. It doesn't tell me anything. I don't know if you guys watched um, the documentary series about Chernobyl. Um, and one of the early issues was after the disaster, all of the scientists were saying, oh, this is a safe level of radiation. It's only 14.8 or whatever the number was. Well, it was only 14.8 because the scale maxed out at 14.8. So really, it was hundreds of times higher than that, higher levels of radiation than that, but their sensors couldn't detect any higher than that. The same thing is kind of true here. Your manual muscle test is maxed out at this level. So 5 out of 5, not useless, but is not a strength test. Use it as a screen, don't use it as a test. Okay, well, what about functional tests, right? These are really, really popular. The Cincinnati Noise Group kind of developed these in the early 2000s, especially the battery of single leg, triple hop tests, crossover hops, hops for time. Well, again, we think these are valuable, but if you're trying to use them as a proxy for strength, that's probably not the best idea. We know that these past couple of years have highlighted a number of studies that highlight why this testing is insufficient to tell us how strong these knees are. They lack strong association with knee strength. They hide asymmetries. They mask biomechanics. Essentially, athletes are really, really good at adapting to um, compensations. So if their knee, especially their quad, is not strong enough to perform a task, what they will do is they will figure out a way to cheat or compensate for that. Um, so functional tests, again, they're useful, but any sort of compound movement is going to be testing a compound movement. It's not going to test the isolated strength. So you can see that the ankle and the hip are much more involved, especially with the propulsive phase of the hop. And when we're measuring distance, really it's that propulsive phase that we're measuring. Certainly the knee's more involved with the deceleration phase, but again, our symmetry number is based on distance. So really it's more of a measure of ankle and hip strategy than it is knee strategy. A lot of individuals much smarter than me have said that your test will test what the test tests. Um, Functional tests, a hop test, well, that measures how well do you hop. It's not a measure of strength. It is a measure of function. All right, so moving on to the instrumented side of things. Well, kind of the gold standard was, and probably still will be isokinetic dynamometry. And guys, if you have access to this, use it. I know there's still a lot of these machines kind of sitting in the corner collecting dust. If you have one, brush it off, figure out how to use it. There is a learning curve, there's some limitations, It does take a little while to run a test. Even when you get proficient at it, it takes some time. It takes up a lot of space. If you don't have access to one, well, we all know they're pretty expensive, and very few places are lucky enough to have these in the budget. Um, so they're great. Build a network. If you know somebody in the area that's got one and you want to send athletes to it, awesome. But we do know there are limitations. And that's where handheld dynamometry comes into play. Now, there are lots of devices on the market. And honestly, like we said before, we want you guys to use dynamometers. We don't necessarily care if it's ours. We do think these things have the ability to improve clinical practice and outcomes for your patients. So if ours doesn't work for you, it doesn't fit your needs, that's fine. We can live with that. We do have a buyer's guide up on our website if you want to look at more details and more information about the stuff that's out there. You can download that for free and kind of see the price points and the websites and read more about it. So as you can see from this page, lots and lots of options. Over on the left side, you've got a number of push or compression type dynamometers. On the right side, a number of pull or tension type dynamometers. In the middle, you have a couple that do both. Well, do dynamometers work? Well, honestly, the devil's in the details. They've been around for a long, long time. We've got studies going all the way back to the 50s of individuals using force gauges to measure strength. Um, but unfortunately, in the research, test positions are hugely variable. The number of different devices people use and their test protocols are also super duper variable. So trying to compare apples to apples can be a real challenge. Generally, we would say most dynamometers work pretty well. The devil is in the details about how you set up your tests. So we're going to really dive into that over the next few slides to talk about how should you test to make your device a little bit more reliable. This first study is trying to look at validity. So what they're doing is they're taking their gold standard isokinetic dynamometer, in this case a Biodex, and they set an individual up to test knee extension on that machine. At the same time, they put a push or a compression type dynamometer embedded in the setup. So they're measuring both through the dynamometer and through the handheld dynamometer and the isokinetic dynamometer at the same time. So they're doing the isometric test, but they're measuring it from both devices at the same time. And you can see the correlations there are nearly identical. They measured almost the exact same force output. So let's take a second to just define our isometric tests a little bit. There are two primary types. There's a make test and a break test. A make test is going to be more of a push into an immovable object. So the tester is holding onto the dynamometer or it's fixed onto some unmoving surface, and the patient or the subject is pushing into that as hard as they can. So that's generally going to be a little bit less threatening, a little less scary. So if you have a patient that's more fearful, they can be in control of how hard they push. A break test is going to be more similar to what we do with the manual muscle test, where you're going to put them in position and then try to move their joint out of position. Generally, you're going to get higher forces with a break test, but it can be a little bit scarier to the individual. So one of the big questions that we need to ask ourselves when we're setting up our test is that test repeatable? So you can see two different examples of how to test hip abduction. On the left, well, this is the exact same position that we would traditionally test this for a manual muscle test. And then on the right, we have an inline setup that's anchored. So on the left, that's going to be a break test. On the right, that's going to be a make test. But if you've ever tested hip abduction and side lying for a manual muscle test, you know there can be a lot of different small tweaks that can impact the amount of force that someone can apply into your hand. How much is their pelvis rotated? Are they in hip internal external rotation? What are they doing with their foot? Did you move your hand slightly proximal or slightly distal? So you can see how there is variability into the system with the test on the left, whereas the one on the right is going to be much more repeatable. You're going to have the individual do the exact same thing every time, more than likely with this test. Next thing we need to consider is your test. Um, what are the joint angles? Are you testing what you want to test? So in this example, they looked at hip internal and external rotation, both in seated and in supine. So the hip was either flexed to 90 degrees or it was in neutral. And then they tested hip internal and external rotation. And you can see from the graphs below, there are some big changes in especially internal rotation strength. So when the hip was flexed and they were sitting up, internal rotation was quite a bit stronger, somewhere around 50% stronger than when they were supine and they were in more of a neutral position. So making sure that you're paying attention to joint angles can be very important as well. So is your test comfortable? This is a big one too. This study looked at knee extension again, so we're assessing quadricep strength. Two different ways. So the picture on the left uses a dynamometer placed over the distal tibia, and they were pushing into that, versus the picture on the right, they put a more robust pad with the dynamometer placed behind the leg of the plant. So still are providing compression to the dynamometer, but you can see over with the charts on the right, an isokinetic dynamometer, that's their gold standard that they were comparing to, had very, very low discomfort. The test on the left had about a 3 out of 10 discomfort, which is somewhat high. And then the one on the right, much lower, about 1.1. And then you can see the mean torque values in the chart below. The two comfortable tests recorded much higher force outputs. So if your test is not comfortable, nobody's going to want to push into it very hard. So going back to range of motion, we got to remember our length tension relationship. So muscles are going to be stronger generally in mid-range. So when the actin and myosin overlap more, they are going to be stronger than at end range. So unless you have a reason not to, and you're testing a specific muscle group, generally you want to be doing that at end range. Generally you want to be doing that in the mid-range, not at end range. To follow up on that point, this study looked at lots of different versions of hip strength tests, and we're going to highlight hip extension, which is the pictures over on the far right. So they tested at negative 10 degrees, 0, 30, 60, 90, and 120. And you can see the force values at negative 10 of around 57 were about a quarter of what they tested around 90 degrees. Now the problem with this is we're taught to test hip extension manual muscle test in prone, right? When somebody lifts their leg up off the table, well, that's a 3+. Already they're either in neutral or negative degrees of hip extension. And you can see from this data that that's really kind of the weakest point of that muscle to test. Unless we have a specific reason to be testing it back there, probably we want to be testing it at more of a mid-range. Next thing to know is, are you stronger than your subject? So now we're going to dive into why external stabilization can be really important. This group tested a lot of different positions with the same dynamometer, but kind of in two different ways. So on the left, they used a tension setup with extra stabilization. So in a lot of cases, body weight of the assessor or the therapist in this case, with the individual just pushing into it. On the right, this is more of like a handheld push or compression setup. And you can see the values here. So on the left, you have lower extremity. On the right, upper extremity. All of the orange hollow circles, those are the pull setup. So all of the pictures that we saw on the previous slide on the left. And all of the red squares, those are all of the push or handheld setups. And you can see there's quite a bit more variability between testers with the push setup. Now there's some with the circles too, but the circles are definitely grouped a lot closer together, and you can see much more consistent findings. We have a number of other examples of that we're going to highlight as well. This is another older study looking at how does the result of dynamometer testing compare from in between testers. So that think of this as your inter-rater reliability. So you can see with shoulder external rotators, a somewhat weak muscle group, you had pretty consistent findings. As we move to a little bit stronger muscle group, the biceps, a little bit wider variability. Examiner 1 is getting higher scores than examiners 2 and 3. And then when we moved into a much stronger muscle group like knee extensors, you can see we have just kind of an unacceptable spread of strength values here from 420 to 225. You know, that's nearly double the score. So that's really not giving us valid information. So as we get into stronger muscle groups, we need to use more of a fixed or an external fixation type setup in order to get better results. This study looked at a few different scenarios as well. So they used their isokinetic dynamometer, an inline fixed dynamometer, and then more of just the push dynamometer on the front of the tibia. So we already talked about how that type of setup might be a little bit uncomfortable, but you can see it had the worst correlation with the gold standard test as compared to the fixed or inline dynamometer at a much, much better correlation with the gold standard. This study looked at a lot of different examiners, so compared two trials, first one on the left versus the second one on the right, and by now you should be able to kind of guess the results of this. So the test on the left correlates with all of the filled in black circles on the graph on the right. So we're getting values anywhere between 200 newtons up to around 900 newtons, depending on which tester. So really that's testing how strong is the person that's holding the dynamometer rather than the person that's kicking. Versus the picture on the right, a more stabilized test, you can see that while there is still a little bit of variability, and we would probably chalk that up to different joint angles, or maybe that strap is not exactly 90 degrees with the shaft of the tibia. But even still, you can see those values fall between, 600 and maybe 1050. It's a much, much more reliable set of data. So this group was interested in if we added a little bit of leverage to the dynamometer, does that improve our reliability? And they found, as you might expect, yeah, absolutely it does. Adding in a little bit longer lever arm, as pictured in the top right, improves the examiner's ability to resist a very, very strong muscle group. So external fixation can absolutely help. That's true both in individuals, when you're testing individuals that are strong, and as we'll see later, individuals that are not necessarily so strong. So using a belt, a frame, or as this group did, improvising some version of a holster or something that holds onto your push dynamometer can improve your reliability with that test and takes the strength of the tester out of the equation. So we talked about how this can be a problem for strong individuals, but it's also true for individuals that are not so strong. They looked at the exact same thing in a elderly frail population and found that they did much, much better with a fixed setup, that their results were more reliable. And these aren't new conclusions. This is data that was collected way back in the 40s and published in 1956, I believe. So people have been looking at this for a long, long time. Um, in 9 to 12-year-olds, we wouldn't expect that to be the strongest population. Um, but this group found that using a fixed method, as pictured on the right, was much better than a unfixed method as measured on the left. Super cool old study here. All right, and as you can probably guess by now, we prefer the setup on the right. It's much more rigid, much more reliable, much more repeatable versus over on the left, you can see probably the picture on the top left. That individual is going to be stronger than my ability to resist with that dynamometer wedged in between my palms. And then the bottom left, well, we're just testing really, really close to end range there. And maybe we're interested in that. If we have a specific reason to be interested in that, great. But if we really want to get what is the maximum capacity of that muscle group or that joint, then probably we want to be testing in a different range of motion. So this is our kind of quick and dirty guide. We've talked a lot about knee extension or quad strength testing. This is how we like to do it. You want to make sure that one, you're getting the feet up off the ground. So you need to elevate the seat in some way, whether that's in a chair with a couple of foam pads or sitting on top of like one of those taller, hollow plyo boxes. You want to make sure that you're fixated. So anchor the dynamometer to something that's not going to move, in this case, a power rack. Strap it around the limb. And then also, I would encourage you guys to try to fixate the proximal thigh to make sure that they're not lifting their hips up off the testing surface while they're doing this. And then make sure it's comfortable. So put a towel or a pad or something underneath their ankle. Make sure that they're not grinding their knee into like a sharp corner. And then finally, make sure that you're testing at the angle you want to. We highly encourage that your testing line of force is perpendicular to the shaft of the tibia and the shaft of whatever it is that you're going to be testing in that given time. And then make it repeatable. So 90 degrees is really easy to see. I would say for knee extension, go ahead and set that up. That's a really strong position for your quads, and that way you know you can go back to it time and time again. As much as possible, we want to try to keep trigonometry out of this equation. If your line of force is not perpendicular to the shaft of the limb that you're testing, well, then you need to do a little bit extra math. So just to make things a little bit simpler, make it perpendicular. I'm not going to dive into the equations there. Other thing to keep in mind is that cueing can make a big, big difference. So how much you're encouraging that individual to push, 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 push as hard as you can. If you're telling them to push as hard as they can over 5 seconds, if you're telling them to push as hard and fast as possible, whatever your cue is, make sure that you're doing it consistently, test versus test, over time, so that you get reliable results. Well, you might be interested in a little bit more than symmetry. So it's really easy to do a dynamometer test. It takes 20, 30 seconds at most, and then it's going to give you some valuable objective information about how do they compare left versus right. So it'll tell you very quickly what does their symmetry look like, but I might be interested in more than that. So what if they both push 20 pounds on their left and their right limb? Is that good? Are they both strong or are they both weak? Do I have two full tires or do I have two flat tires? Well, you've got a couple of options for that. Number one, you can compare to current handheld dynamometer norms. Some of the limitations with this, we've tried to address as many of them as we can with a really big data extraction database that we have on our website. It's also free to download. And you can see what have other researchers looked at in similar positions for similar joints that I want to test, and then try to match up your population to what the researchers have looked at. The issue is, as we mentioned before, each study is really variable in the decisions that they make, as far as test positions and test setups. Your other option is to use established torque norms from more reliable, robust setup positions from isokinetic machines. Dynamometers measure force. Handheld dynamometers measure inline, straight line force. Isokinetic dynamometers measure torque. To convert force to torque, you need to multiply times the length of the axis of rotation that you're measuring. So for instance, if you're measuring the extension, then we need to measure the length of the tibia from the axis of rotation of the knee to the midline of whatever the strap is that you're pushing into. And that will give you a torque measure. And then as long as you're consistent about the way that you're really detailed about the way that you set your test up, you control for your joint angles well, you make sure to stabilize the proximal femur, then you can compare that to similar setups with isokinetic dynamometers. So what we've done for you guys is we made a nice little decision tree to give you an idea of, is my test setup good? Is it going to be repeatable? Is it going to give me valuable information? So first we want to know, is it repeatable? That's the first step. Have you isolated what you want to test? If you're really interested in, let's say, hip extension, well, do I measure that at the ankle? Is that going to bring too much hamstring into play, or am I going to measure it proximal to the knee? Depends on what it is that you want to measure. Is it comfortable? We've highlighted a number of times how uncomfortable tests are going to give you lower force readings. Are you testing in mid-range? And if you're not, do you have a specific reason not to? Next, we need to know how high are the forces. So what I really encourage you guys to do is as soon as you get a dynamometer, first thing you do when you get it out of the box, take it to a wall, push into the wall as hard as you can, and see what is my max as a tester. And then you know that when you're doing tests in the clinic with real patients, if you're getting close to that value, in this instance, we recommend anything higher than like 50% of whatever your as a tester max is, well, then probably you need to be bringing in external fixation, whether that's for a push dynamometer or a pull dynamometer. Moral of the story is we want you guys to use these devices. We've seen it in our own personal practice. It can absolutely improve your outcomes, it can improve your buy-in with patient, gives you more objective information to track so that you can make better decisions. But just because you have a good piece of tech doesn't necessarily mean that you're testing well. So these are a couple of examples of what not to do, right? These two pictures on the left, we like the idea that they were going for stability, but we really worry about the safety of the wrist and the forearm of the tester if the subject is really pushing as hard as they can. Finally, test, don't guess. Objective strength measuring is what we're all about. Having hard objective data gives you better information, allows you to make better decisions. We don't care which device you use. We just want you guys to improve practice by using better data. Thanks for listening. Check us out. And as always, test, don't guess.